Hi, here we are looking at our last video. This is going to be looking at health in this part. We're going to look at coping with stress, evaluating stress, looking at also health and disease in our lifestyle, and the impact of our lifestyle and our health. So let's begin with a definition about coping. Coping refers to our efforts to deal with the demands that we perceive as taxing or overwhelming. There isn't a one strategy for coping. We gather coping strategies throughout our life to deal with different stressors. Now there's two primary categories of coping. According to Lazarus and Folkman, there are problem-focused solutions and there are emotion-focused coping. We're going to look at each of these individually. We'll start with problem-focused coping as a response aimed at reducing, modifying, or eliminating the source of stress. It's used when the problem can't be eliminated or changed, so it's no longer stressful, so that with the impact of the stressor is reduced. So we use this as a sort of when we want to sort out and think about what we need to do. This could be your budgeting. That's a problem-focused coping. You're going to be doing some changes to your spending habits based on your money that's coming in and the money that needs to go out and your budgeting to make ends meet. That's a problem-focused coping with the stress of it's hard to make ends meet. Now, the emotion-focused coping is aimed at reducing the emotional impact of the stressor. So it's often used with problem coping in combination with, and it involves changing one's emotional reactions to the stressor. And then that can be really important. There's times we withdraw from challenging events because we have an emotional response to this event that we want to avoid, so we walk away from it. And that's a strategy. But maybe part of the emotion-focused coping would be how to manage our emotions better to approach this problem differently. That's also a part of that. So one of the best stress management strategies is a combination of problem-focused and emotion-focused coping. For example, a cancer patient may try ignoring his anxiety, that's the emotion-focused coping that he's applying, while actively pursuing treatment options, which is problem-focused. So often this combination is important because if you remember from emotions, we have a physiological, a behavioral, and a cognitive component. So trying to work with those three on our emotions is important in terms of emotion-focused. Problem-focused just helps us at the mechanics of dealing with some of these stresses in our life. Now, some additional positive coping strategies can include breaking things into smaller tasks. It's called chunking. And so that can help make it more possible to deal with some stressors by breaking it into smaller pieces. Setting up a system of rewards for small accomplishments. That just means reward yourself. But don't reward yourself only for big. Break things into small packages, small tasks, and reward yourself for the small events as well. Act now. That's probably is more useful than you think. Acting now. When someone sets a goal, oftentimes they set a goal and they start the goal in a week from now. I'm going to start losing weight on this day in the future. If it's too far, and that can be even a couple of days, we don't get a chance to build momentum. And by the time that date arrives, we found lots of reasons why we can't start then. So any goal that I would recommend anybody set, start today, now. It might not be that you're doing all the steps to do that weight loss, but maybe you're going today to buy the journal that you're going to write in that will help you with this goal. So that's one thing you've done towards your goal by acting now. Another coping strategy is seek out social support. And that's really important. Having a social network is important. People who you can rely on and who will be there for you if you need there. Now, an interesting one that's often overlooked, and that is help others. You might be surprised how positive you start to get your head around your problems when you help others. Use both the problem-focused and emotion-focused coping strategies. Have an optimistic outlook. Now, not everyone is wired optimistically, but making it an effort to try to be more optimistic about some stressors may help us deal with those things and cope more positively. One step would be do not turn to drugs and alcohol as far as a coping mechanism. So, how can we evaluate life stresses? And if so, how do we do this evaluating? Well, there's this social adjustment rating scale, and you may have seen this. It's designed to measure stress with a ranking measure. The social readjustment rating scale assesses stress in terms of life events that necessitate life change. So these would be life events that, as a result of making these life changes, good and bad, they cause stress. We have to, they are stressful. And now it ranks 43 life events from most to least stressful and assigns a point value for each one. Holmes and Ray have found a relationship between the degree of life stresses, that is measured on the scale, and major health problems. And they found that the major life changes often precede serious illness. Now you'll see in the behind me there what that would look like, and you'll see in your textbook there's a student version which it looks very much like this, and you can sort of get an idea of these major life experiences, how many of them affect my life, and that might help me understand where some of my stress might be coming from and what I might be able to do. Problem focused, emotion focused. Now, according to Lazarus, daily hassles, and that's a psychological term, daily hassles, are the interrupting, frustrating, distressing demands and troubled relationships that affect us day to day. So the daily hassles are our day-to-day stressors that aren't necessarily huge and monumental, but they are everyday, frequently. They typically cause more stress than major life changes, because major life changes are often predictable. Not always, but they're ones we can prepare for, whereas daily hassles are things that just come up. You go out to get in your car and it doesn't start right away. A daily hassle. You get out of your car and go to lift your hood and you catch your finger in the hood. Daily hassle. Now, the positive experiences in life, these are called uplifts. These are positive experiences with friends, families, and social gatherings, and these are the things that can neutralize many of the effects of hassles. Hassles just being those negative things that occur typically on a daily basis. So what about the effect of stress on our health and therefore the relationship between health and disease? And we're going to look at two illnesses just briefly, cancer and AIDS. Now, health psychologists recommend to include these positive strategies for coping with cancer and cancer treatment. The research has found that more people who can approach their diagnosis of cancer and therefore also their remediation and getting as healthy as they can are often using many of these strategies and others to deal with the stress of cancer. So they include positive strategies that include ability to discuss fears and anxiety. I mean, keeping those things and those thoughts inside are not helping us deal with them better. It just compartmentalizes and sort of keeps things in. That doesn't solve the problem. It just sort of hangs on to them. Be given information about their fears and anxiety, to connect with other people, to get information on how to deal with some of those things as it relates to cancer are thought to be very positive. Now again, we're looking at problem-focused and emotion-focused. They need to be taught on how to lower arousal for some of the controls over treatment and have a more optimistic outlook. And again, these are skills that we can learn. Accept the reality of the situation. Now that's easier said than done for many people. It's not unlike with some of the mourning strategies, that acceptance. I have cancer and it is something I'm going to deal with is a better situation than denying that you have cancer or trying not to believe that you could possibly have cancer. So accept the reality. Maintain a sense of humor has always been a strong point for some people, but it's a good way to sort of create little uplifts. Social support is always important. Focus on the positive and create distractions, things that can get your mind off of what you're worried about. Now, psychological impact of HIV infection and AIDS and strategies for coping psychologically. Well, most people are devastated when they are diagnosed with AIDS. They are sentenced to an early death and face social stigma. To cope, education and information must be given to patients. Self-help groups, group therapy, medication can also help. Now, along those lines, there's a psychoneuroimmunology. Sorry about that. And it's a field of study in which psychologists, biologists, and medical research combine their expertise to learn how psychological factors affect the immune system. Now, research has shown that stress can impair the functioning of the immune system, specifically stress associated with the increase of illness behaviors, such as reporting physical symptoms, seeking the medical care. Stress has the power to suppress the immune system long after the stressful experience is over. All the more reason to ensure that we do what we can, problem-focused and emotion-focused, to provide us with the kinds of consequence management that keep us as healthy as we can. Now, we have personal factors that can also reduce the impact of stress and illness, and one of them is optimism. Now, you would expect that people who are generally optimistic cope better with stress and may reduce the risk of illness, and that holds true in research. Research has uncovered 3 additional qualities other than just optimism. Optimism is something that can be gained. Some come by it more naturally than others. But these other 3 additional qualities that distinguish those people who manage to stay healthy regardless of stress, and these 3 things are commitment, challenge, and control. These 3 qualities are known as hardiness. Hardy people have a strong sense of commitment to what they do professionally or personally. They don't just go into things a little bit, they go in all in. They're fully committed. They see themselves as in control over the consequences that occur, and they welcome challenges. Now, hardiness, in psychology, it's been argued it's a bit like a trait. It's something that we're either born with a lot of or not born with very much at all. You can impact some of it, but I don't know. I mean, our research hasn't really said that you're able to actually nurture a full head of hardiness, as it were. You can get hardier, and it's an important contribution to one's own health, is to be hardy and willingness to commit to things, not just part way, but all the way in. Feel that you control the outcomes of your life. The outcomes of your life don't control you, and welcome those challenges. Gain more strength and competency. Additionally, and I've mentioned this already and will continue to do so, is social support is a factor that contributes to better health. Social support includes tangible support and help. Now, tangible support and help just means that more that face-to-face, you can have the tactile experience of a hug. Those are the tangible supports and help that are referenced here. Information is important. Advice, emotional support. Social support provides the feeling that we are loved, valued, and cared for. Social support has positive effects on the body's immune, cardiovascular, and endocrine systems, which control a good deal about our experiences and how we experience stress. Your lifestyle and your health. Let's consider some factors that constitute an unhealthy lifestyle, and you'll find a few more of these in your textbook. Slightly over 50% of all deaths in this country can be attributed to unhealthy factors. These can include smoking, overeating, unhealthy diet, too much coffee, guilty, or alcohol, drug abuse, and or too little exercise or rest. Now, this is not brand new information. I'm over 60 and I've been hearing this message about smoking, overeating, diet, drug abuse, and exercise most of my life. I'm sure you have as well. So these aren't new discoveries. The difficulty is using the problem focused coping and emotion focused coping to get us involved in these aspects of our life to make an improvement in how we can handle stress and therefore the quality of our overall life experience. Now, factors that can diminish a smoker's ability to quit smoking, some strategies: commitment. Absolutely. I quit smoking on October 26, 1981. I know it's a long time ago. It was just as hard then as it is now. We just didn't have all the other tools. My commitment was that I was going to quit smoking. I set a specific date. I told everybody that I worked with on the date that I was going to quit, and I stopped cold turkey. Now, that was the way I did it. Everybody has their own way, but commitment, you'd have to decide, and it's not just, I'm going to try to quit today. If it doesn't happen, I'll try it again next week. That's not commitment. Commitment is you're fully in. Strategies used is around perceived stress. Altering your perception about stress. Is there another way that you can view stress that enables you, so some people smoke because it relaxes them. Well, what else can you do? I helped this one woman who was a smoker, and she said, I just love when I can just get outside, take a deep inhale, and just let the smoke go out slowly, look at the day, and sort of changes my feeling. And I said, well, what if you did that without the cigarette? You go outside and take a deep breath, let it out slowly, and look at over the beautiful day. And she started to do that. And that became one of the impetuses for her to quit smoking. So recognizing perceived stress, social supports, education, these are all important elements to help diminish a smoker's ability, or helps a smoker quit. The disease model of alcoholism maintains that alcoholism is a disease, and once you become an alcoholic, you're always an alcoholic. Now, treatment is based on abstinence because even a small amount of alcohol will cause cravings for more. Now, this model also suggests that there is a genetic component to alcoholism. This model is limited because it doesn't take into effect any environmental factors such as family, culture, that they aren't taken into account. Now, regular aerobic exercises, that doesn't have to be running a marathon. Regular aerobic exercise reduces the risk of cardiovascular disease, increases muscle strength, moderates the effects of stress, and makes bones denser and stronger, and helps maintain a desirable weight. Now, you can get great benefits from as little as, and I know this sounds like maybe a lot, but if you spread it out over the course of a week, it's not, but 2.5 hours a week of aerobic exercise. This could be walking, running, swimming, gardening, washing the car. It could be a number of different things, but sustained aerobic activity just means you've increased your heart rate beyond resting. That doesn't have to be a lot, but these small, I shouldn't say small because they're not. These elements that you can do in your lifestyle to make a difference in the quality of your life. If you want to live a long life, you need to look after the only body that you've got. All right? I hope this has been a helpful course for you. We are at the end. Finished, complete, ta-da! Good luck in your future. I hope you'll take another course from me in the future. If not, good luck, and if you do, we'll see you again. Bye now.